Hi, everybody. My name is Rebecca Flick. I'm the Chief External Affairs Officer for Resolve, the National Infertility Association. And you're here listening to a kitchen table conversation. It's a new digital series hosted by Resolve, which brings back the nostalgia of our founding around Barbara Eck's kitchen table. Ms. Eck founded the first Resolve support group in 1974, where she brought women together to discuss issues that mattered to them. We are proud to carry on this tradition virtually through our nationwide network of support groups and through this new web series, where we tackle topics important to anyone who's challenged in building a family. Today's kitchen table conversation is Navigating Friends and Infertility and is sponsored by our friends at First Response. So thank you, First Response, for making this conversation happen. I have an amazing panel of women here at my kitchen table to talk about their personal journeys, to offer professional advice from our experts on the panel, and to have just a real honest conversation about how we navigate our friendships and our relationships while we're dealing with infertility. I think it's a really important conversation that we, as the infertility community, can educate others. So I really encourage you, if you're watching this and you're dealing with infertility, share this with someone that you love that's not dealing with infertility. I think they'll really help them understand what it is that you may need from them in their relationship. So I want this amazing panel to introduce themselves. I'm gonna start with our good friend and advocate, Nichelle Sublett.
Hi, everyone. Thanks for having me today. I'm Nichelle Sublett, and I'll start by giving just a little brief description of my journey. So I got married in 2013 to my husband, and immediately I knew that I wanted to get off the pill and just kind of see what happens. A lot of people are familiar with the trying but not trying. I'm not sure if he was 100% in, but that's okay. So within a couple months, actually about 6 months, I knew that something was going on. I was getting a period every month, but we still weren't pregnant. Went to see my OBGYN. She diagnosed me with PCOS, or polycystic ovary syndrome. And at that point, I went on Clomid for a couple months, did get pregnant the second month, but ended up having a miscarriage. And the only thing she thought was maybe that it was not the only thing, but basically it looked like there was something genetically wrong with the baby, and which is why I lost that pregnancy. So at that point, we decided to take a break. She then referred us to a fertility doctor, and that started a 5-year journey, actually 6-year journey of more Clomid, letrozole. I did lots of IUIs. I did 2 egg retrievals and 2 IVF embryo transfers. Within that time, I also had 2 naturally conceived pregnancies and ended up suffering from 5 miscarriages over that period of time. So during that time, I was seeing a therapist, and she recommended Resolve. She said that they had great groups. So I started going to the meetings monthly. It was very therapeutic for me. I met lifelong friends. It allowed me to be around people who really understood this journey and what I was going through. And in 2018, I became Mrs. North Carolina. I competed for a pageant for the first time and just kind of took a giant break from all things infertility. We were actively preventing pregnancy that year and decided to just enjoy that year. And that was the year that I became public about my journey. So I started speaking about it, definitely sharing things on social media and meeting lots of people who were going through the same thing. So really trying to inspire hope in this community and encourage women to start asking their doctors when they should get, or start asking their doctors prior to like wanting to get pregnant about a fertility assessment, because I feel like that knowledge is power, and knowing earlier can definitely save you a lot of heartache on the back end. So after that year, and I also made infertility awareness my platform. So that was a big thing I was pushing that year, and I'm still continuing to push. After that year, we tried one more IVF embryo transfer, and that one was actually successful. So I do now have a 16-month-old son, Hudson, and we are getting ready to start the process. I have all my meds to do another embryo transfer. We're trying to have a sibling for him in 2021, hopefully. So that's where we are.
Thank you, Nichelle. I'm glad you found resolve. I'm glad we were there for you.
Thank you.
And you have been such an amazing voice for raising awareness and advocacy as well. So thank you.
Thank you.
Another amazing patient advocacy or advocate that we have here on the panel is our dear friend, Chloe Melas. Chloe, you're on, yep, there you go. Would love to hear her.
Yes. So
I get to see you in person, kind of one day in person again.
I know. Well, listen, thank you for having me. It's so great to be, meeting new people and new friends like Laura, Nichelle, and Dr. Jeelani. So I have two little boys, both from IVF. We did IVF at Weill Cornell Center for Reproductive Medicine in Manhattan, but this was after transferring clinics, multiple failed IUIs that were medicated. My husband has sperm issues with his motility, his morphology. Many times I thought that IVF was the end of the road, but it ended up bringing me my family. I have thought about maybe going for a third, but we don't have any embryos frozen. Each time we did a 3-day transfer. And it's really hard emotionally to just go through it. And I know we'll discuss some of that today. I'm an entertainment reporter for CNN. So juggling the IVF process along with a full-time job I found it really, really difficult. And I'm just really glad to be sharing our story and trying to help people and inspire some hope.
Thanks, Chloe. Dr. Jeelani, love to hear more about you. I know you've been part of the Resolve world for a long time, and I feel like I was thinking about it when I knew we were going to talk today, like thinking about the beginning of this year, when you and all of those amazing doctors who are like social media influencers, doing everything you're doing on Instagram, came together and like kind of had this rally for Resolve, like when COVID hit. And I thought, oh my gosh, that felt like so long ago. And it really was just the beginning or almost a year ago. So thank you for everything you do for this community. But I think there's probably a lot that people don't know about your personal story.
Yeah, of course. I think I'm privileged that I get to see it from both sides, one practicing it daily and then two being a patient. And you guys are just amazing from both as, being a physician, taking care of infertility patients, having that community and kind of pointing my patients saying, hey, go here, kind of like Nichelle said, it's such a good, it's therapeutic, right? To see that you're not alone, because infertility can be so isolating and you literally feel like the only person in the world. And it's like when you buy that new car, when you're trying to get pregnant, everyone around you is pregnant and all you see are announcements. That's how it feels, unfortunately, or fortunately for them, but unfortunately that you feel so alone. And I think what Resolve provides is, I can't put it in words. That's how amazing it is. But I'm a fertility doctor by training, but I'm also a fertility patient. Kind of like Nichelle, I genetically had PCOS and kind of knew very early on that I would need fertility help. I guess the extent of my fertility help and intervention, I couldn't fathom. So at a very young age, I was diagnosed with PCOS and I was told that you will eventually need fertility help and it'll be a pill. So all you need is ovulation. So went to my doctor when we were ready and ovulated, nothing happened. Then escalated it, went to a fertility doctor, ovulated, nothing happened. And then, you slowly, like Chloe said, you baby step your way in. So I added an IUI, then I added a trigger shot, then I added this. And it was just frustrating. And I would hear them, I would say, okay, you need IVF, you failed this. And in my head, I was like, what, wait, there's one more, I'm going to do one more, and switching clinics and thinking that I could do alternates to IVF, not to say IVF's the end all be all. IUIs do work for some people, but in my case, it wasn't. And after doing IVF, we realized that, hey, you have a lot of X, but the quality is really bad and you're not going to make it to freeze. And this is your shot. So I think by the time I realized and had done IVF, I was just ready to be a mom. And I was like, just give me whatever I can take and I want it over and done. But I'm also a beautiful baby boy. I have a baby girl, and I'm getting ready to start infertility treatment again. And it's scary, but I'm excited at the same time.
You've probably learned a lot, over these years, and maybe you'll be the perfect patient for yourself. All right, well, thank you.
I was going to say doctors make the worst patients. I think they literally had to drag me in. They're like, you have to baseline. I'm like, okay, fine.
Well, last but certainly not least, because this is the person that's really going to give a lot of clarity to the feelings and the stories that we're sharing today, is Dr. Laura Covington. Thank you for joining us.
Yes, thanks for having me. It's always different being on the other side of it too, of being the patient versus being a doctor. And your story just resonates with me. And so I am a mental health professional. 100% of what I do is infertility work. And I see patients kind of at different points of the journey, as well as I lead several support groups. The support groups are really my favorite part of doing this work, because it's so fun to be able to see people come together and really relate to one another. I have one of the support groups I run, I've had several people who at the end of it will go, well, that didn't suck, meaning that really that they thought that they walked in, they thought they were kind of intimidated by this word support group, and they walked out of it, and then they ended up coming every month after that and really enjoying it and really being able to connect with one another. And it's just really lovely to be able to see and be a part of so many different people's journeys as they go through fertility treatment.
What do you think? I'm going to start with you, Dr. Covington. When you think about the people that you see, like, what is the common thread among them that their biggest struggle that they have with their fertile friends, meaning the friends that are in their peer groups that maybe they went to college with, and they all embark on this journey to start a family, and the person struggling with infertility is left behind? What is the common struggle that they have with those relationships?
I think it's there's so many different things that kind of come to mind, but I think it's often feeling misunderstood, that their friends don't really understand what they're going through, or can't understand what they're going through, either because they just haven't been through it themselves, or they also haven't shared it with their friends. I think it's also hearing other people's journeys who have been able to be successful in a pregnancy and having so many mixed feelings, feeling really sad and angry and upset at where they are, but then wanting to feel happy for their other friend, but really struggling with feeling happy for their other friend. Yeah, so I think that there's many different things. I would say that those are kind of the main topics that come up to my top of my head.
Did anybody, I'm seeing us all kind of nod our heads, have we all felt that way? Yeah. Anybody? How did you get through it, Nichelle? What were those moments like, and what did you kind of do to get through them?
Yeah, this is huge with infertility. The whole, okay, I need to be able to put my feelings aside for a moment and try to be happy for someone else. So I think for me, I tried to process it just really to the best of my ability. For instance, with pregnancy announcements, I actually reached out to all of my friends who I thought were about to get pregnant. And I asked them if they could send me a text message as their announcement. And I wasn't trying to rob them of their announcement, but I had been in the situation too many times where I was caught off guard by a public announcement, basically, or even just me and a friend at lunch. And I know they were trying to be sensitive and have us, just the two of us, and tell me, but it left me put on the spot. So I think one thing I tried to do was cheer them on, be happy for them, but also be protective of my own needs. And I felt like by receiving that message and then having the opportunity to take a look at it and process that by myself was much better than in a public setting.
Yeah. Chloe, did you similar or?
Oh, Yeah, I mean, just first of all, I mean, when I was trying to get pregnant, I thought every single human in the world was pregnant. I mean, I noticed every single pregnant person in the grocery store, at Starbucks. I hated everybody. I was not happy for anybody. I was super jealous and resentful and bitter. I remember being in the bathtub and my husband told me that his best friend was pregnant with twins, and I almost died. I was just like, you got to be kidding me. Like, I was crying. I was so angry. And I knew that all those feelings were just not okay and just not normal. But I was so, why is this happening to me? You know, why can't I get pregnant? This is so unfair. I was so upset. So by the time I got to IVF, you know, looking back, like, you would think that, like, okay, you know, I feel good about this. Like, I had some insurance support, you know, I have my husband there, you know, I've told just my mom and a couple people, but we didn't tell a lot of people that we were going through IVF. And you would think that, like, okay, like, you'll be happy now. You have some resolve that you're going to start this journey. And I was anything but. I was so at, like, the bottom moment of my life. I felt like there was nowhere left to turn. It felt so dark. And I was actually really depressed going through IVF. And I'm sure that the hormones didn't help me. I don't even think I was happy. I think this whole experience robbed me of even an enjoyable pregnancy until I was probably like 8 months into my pregnancy, when I actually started to believe that, like, this could really happen. Now, I never had a miscarriage or anything like that, but I just really just always felt like the other shoe was about to drop. I don't really know if I ever got over my resentment or anything like that until I finally did get pregnant, unfortunately, myself.
And did that have any, like, how did you navigate your friendships, like, with Brian's best friend? And did you lose friends or?
I didn't go to baby showers. I didn't go. I mean, every single person I knew got pregnant before me. So I think I just faked it. You know, I think all my girlfriends knew that I was trying, but I didn't tell anybody that I was going through IVF. This was like my dark secret that I kept. So I just kind of faked it with all my close girlfriends. But yeah, I mean, every pregnancy announcement made me just depressed. But like, then it's kind of hypocritical of me, because then I turned around and I did my own pregnancy announcement, and I like went all out with like all my animals. I have 2 cats and a dog. Like, I got everybody involved because I was like, this is my moment now. But then that's why I eventually decided that I wanted to share my story, because I wanted to explain that it's not all Instagram rainbows, pregnancy announcements, that there is a dark journey that can sometimes be behind that. And that's why I wanted to come forward and finally share what we went through, because people had no idea, and especially no one talks about male factor infertility, you know, and for my husband to come out and talk about that was huge, you know, because so many people think that, oh, okay, well, it must be the woman, you know, but it was both of us, but, you know, but yeah, I mean, I didn't lose friendships over it, but like, I didn't go to baby showers. I just, you know, was lots of tears. I cried for many years, you know, it was a really dark time.
It sounds like you had then support that you didn't realize you were getting. So friendships sustained, lasted despite not, you know, being at those baby showers or, you know, or not sharing the pain helps, you know, sustain some friendships. So I'm glad unfortunately, I wish you had like more support. Like, I'm like, oh, I wish, you know, you felt more supported and didn't feel so alone and sad. But I'm glad that you guys were able to get through those dark times. I want to ask the professionals with us today, like, can you explain to somebody maybe who's watching or listening, who has an experience of fertility, why there's this extreme emotional part of infertility? Like, what is it? What are people with infertility experiencing? I know there's research out there that says infertility diagnosis is as impactful on mental health as cancer diagnosis. So what can we share with people who are learning about this, or who maybe be friends with people who are going through infertility? Everything that these 2 women just shared is normal. Yes.
Laura, you're the expert, so I'll let you speak to that. But I do have something from a patient and a provider perspective, but I'll let the professional, this is your bread and butter.
Yeah, I mean, absolutely. It is, you know, the emotional reasons are often one of the top reasons for drop out of treatment, not actually because of financial or other reasons. And because there is a really hard burden on this, and feeling broken, feeling frustrated, sad, feeling like life is unfair, and not understanding kind of why a very basic piece of who we are as women aren't happening naturally. And, you know, so it takes a lot to go through it. And I think it's oftentimes too the first time that people are really dealing with these hard feelings in their lifetime. It's one of the first experiences that they have with the feelings, and they don't know what to do with them or how to handle them. And I think that's often there's things to be gained and learned out of the feeling those feelings, but I think it's often so uncomfortable to deal with those negative feelings: anger, sadness, frustration.
I agree, and I think also just kind of reflecting, and I know hindsight's 2020. I think, and this reminds me, and you know, when you have that aha moment, I went to my niece's kindergarten, like graduation, and they had all their report cards and what they did and what they want to be. And I was reading her thing, and this is going to make me cry, but I was reading her thing and it said, when I grow up, I want to be a mommy. And I was like, oh my God, it's like human nature. It's like built in us that, you know, it's just part of us. Like, we're going to grow up and we're going to be a mom. And it's almost a shame and a taboo that we just don't talk about it, right? Like I'm not saying that it should be thrown in our face, but we should at least learn about our cycle. Like, we should at least be educated. Like, this is how many eggs you have. This is what fertility means. This is when you should try to have a kid and what this means. And it's not a shame to go seek help sooner. Like, I was so shy to seek a doctor because I was like, well, of course, if I have PCOS and everything's fine, maybe I'm just being anxious because I see this all the time. Like, it's okay. It's okay just to get tested, and it's okay that, you know, everyone's different. And I think if we normalize that, and you guys do such a good job of kind of saying, Resolve, this is, you know, we're here, fertility preservation, and all aspects of that.
So I would just add to that too, is that so often people feel like, oh, it's okay for somebody else to go through IVF. You know, they normalize it. It's all right for everybody else, but when it's yourself, right, it's totally different. And I think that's the hard part. People do it because what I often do, and when I'm talking with patients, is, well, what is it like for you to think about your other friend or that other person that, you know, went through IVF? And they'll say, oh, it's fine. It's not a big deal. It doesn't mean anything less about them. But then when you talk about it with yourself, it does mean something different, and it means something different about your body, and it shouldn't be that way for me.
That's great. Nichelle, I want to go back to something that you said. You were really thoughtful in going to your friends and saying, I don't want to take away your joy, but you need to protect yourself as well. And did that resonate with them? Did anybody have a hard time with it? I don't want you to publicly throw anybody off under the bus. Because I was given that advice. I have a 13-year-old through IVF, and I was given that advice many moons ago, and by somebody at Resolve, and I did that, and I had women in my life that didn't honor my ask, and that was really, really tough.
Wow. Yeah, that's really tough. Fortunately, my friends understood. Well, I think they understood to the best that they could. Mm-hmm. All of my friends, for the most part, all of my friends got pregnant before I did, had kids before I did, and most of them with no issues at all. So for them, thankfully, I think they were able to step outside of themselves and see that maybe I just don't understand everything that's going on here emotionally. So thankfully, everyone did honor my wishes. And at first I don't know if I said this, but I felt kind of silly at first sending it, like, oh, a text message, like, I'm going to text everybody and tell them this. But I think one thing that resonated with me is nobody can be there and be supportive of you and what you're going through if they don't know what you're going through. So if they have no idea how a pregnancy announcement was affecting me, which I don't think that most of them did, then why would they stop doing what they're doing? So as angry as I used to get about it, because like Chloe said, it would take me a long time to kind of get over someone's announcement and get to a point where I could genuinely be happy. Lots of tears, lots of nights of, why me, and the frustration, and just feeling like, is this some big joke? Like, what is going on? Why am I the only one? And I want this so bad. And there were times where I felt like I wanted it more than the people who it was happening to. So thankfully, to get back to your question, I do think people took it well. And if they didn't tell me.
Yeah, it's hard. It's hard. This is what this conversation is about. It's like navigating these friendships and relationships that we want in our lives, and we're going through this, and we want these relationships are important to us. And we want, people to understand what we're going through. Chloe, let me ask you this. If you were, to give someone who's about, or just found out they're going to struggle to build their family, a piece of advice, first of all, I want to know what that advice would be. And then I also want to know if you wished you had been more open with friends during it. Now that you're on the other side and you're so involved in raising awareness, would you not have done anything differently? Because I don't want you to have any regrets, but like, is there something, this makes sense now. I see why people share it.
Yeah. So, it's really interesting. I don't know if it's just because I'm like in the mix now of this community. I didn't know about this infertility community. I just feel like with social media and now celebrities sharing their experiences and people like Meghan Markle writing op-eds. And I just feel like it is a lot more normalized even in the last 2 years. Even, I don't regret not sharing it because at the time, I promise I didn't have one friend that told me that they were having problems. I didn't know one family member, definitely had never heard of male factor infertility. I felt ashamed. I felt like I had like the scarlet letter. I mean, I just didn't want anybody to know. I was so embarrassed. And I just figured I was just going to get pregnant and nobody was ever going to know that I did IVF. So it really wasn't actually until my boss on my first day of work at CNN, I won't name her, but it's my boss. So I'm sure you can find her. She said something to me about wanting, if I want to start a family, that she would be there for me. And she just made a couple comments to me. And I was so shocked because I had never had somebody talk about family in like a work setting. And I didn't think that in my career that being, a mom and having a professional job was even something that was even like, my dad actually told me once that you can't do both things well. Unfortunately, that's just like the way that he thinks. Love my dad, but it's kind of a way of thinking. So that always kind of stuck with me. So then I shared early on with her about my IVF journey, that I was going to do it because I only did IVF a few months into working at CNN. And then she told me she had gone through her own journey. And then a few guys at work shared their journeys with me, that they were actively going through IVF with their wives. And I had a community, I had a tribe of men at work that were the husbands, and we were at work and I was the woman going through it, and we're all going through IVF at the same time, which was actually really cool. So when I did get pregnant with Luke the second time, it was at that point that I was like, I'm going to share this. Like, people need to know I am proud of it. I went through hell. I am so excited to share this with everybody because I know that there's people keeping this secret too. And if I had advice, I think it would just be like, I know it's so dark right now, but there really are options. There are a lot of options. And I just didn't know that there were any options. The day that we were told that my husband had, just terrible sperm issues, I really thought like, this is it. This is over. I will never have children, biological or not. I had such tunnel vision. So I would just say, like, there are options. Educate yourself. There's so many resources with Resolve to learn about different things, you know? But people didn't talk about it like they are now. I swear they didn't. So I'm so glad that we're doing this, because this is what fosters a community. I really felt so alone. So I wouldn't change anything, but I'm so glad I'm talking about it now.
We are too. Thank you. So I want to end our time together, which I really don't, because I could talk to all of you all day. And I'm really kind of proud of us, because we haven't really shed a tear. And I know how hard all of this has been on so many of us. And usually I just get overwhelmed with emotion just talking to people who are passionate about this community. So I want to, first of all, thank you all. But I just want you guys, I want to give you each a moment to talk to that person that was you, and maybe share one thing to that woman that's watching who's having a hard time with her friend. I won't pick on anybody. Does someone want to start? Just talk to that person. Who wants to go first? Oh my gosh, don't make me pick on you, Dr. Jeelani.
I was gonna be like, oh my God, don't pick me, because I'll break your streak of crying.
Oh, it's okay.
If I could talk to the person that was me, or a friend of the person.
Whoever you want to talk to, someone watching right now, if you want to talk to that fertile friend or the person who's struggling.
Okay. I'll talk to the person who's struggling, because I think what Chloe said struck a chord. I did not share my journey either. And I don't think I was in the right spot to share my journey. I think by the time I was in realizing I was actually doing fertility treatment on myself and seeking care, I was so angry. I was angry at the world around me, and I was so upset. Now you're going to break my streak. I'm not crying. If I could talk to that person, I would say, like, there's so many options, and we don't hear about them and we don't talk about them, but that doesn't mean they're not options. And there's so many ways to be a parent. It might not be how you predicted, and that might not be how you envisioned, and it might be way more intervention or way less intervention. But there's a million ways to build that family that you wanted. And I think to that friend is, you never know. Like, I'm infamous for bottling my feelings and not talking about it, but just because I'm smiling on Instagram, or if somebody's smiling in front of you, you don't know how they got there. And like Chloe said, right, your announcements are beautiful, you're all out, but you don't know the story behind it. So I think always talk to the person in front of you as if there's a story behind there, that it's not, all that shines is not glitter. So just be very careful what you say, and just be mindful. I learned being vague is much easier than being specific.
That's good advice. And we are a community that puts our hands on each other's backs. And so we're giving you a big hug right at the moment. All right, Nichelle.
Yeah, I would tell someone struggling with infertility, and also, like, when I would say this to myself now in hindsight, is that you are so strong, you're so resilient, and you are a warrior. And really, this time is building you for something much bigger. And hopefully you'll get what you want, which is parenthood. But I know some resolve with remaining childless. However, a family or a person chooses to resolve their journey, like, this is building you for something greater. And I think that's seriously what I would tell myself when I was going through it. In hindsight, that's not what I told myself. I wish I had. But just that it's going to build you up. It really is. And it's going to get better. And I think one day it will make sense. And I think for someone who's supporting someone or knows someone who's going through infertility, I would say to try to be patient. Understand that your friend may want to talk about it one day, the next day doesn't want to talk about it. One day is happy, one day is not. And that you're just going to kind of have to go with the flow and let him or her lead this dynamic. I remember, I mean, a short anecdote, I can remember being frustrated when I would tell someone we were taking a step and then they would follow up with me about it. And I'd be upset, like, wait, no, they weren't supposed to ask me how it went. Like, I don't want to talk about it. But then other times I'd take a step and be upset that someone didn't follow up. So it's just, the mind is very chaotic when you're going through it. So please have patience and try to be as empathetic as possible to your friend.
That hits me. I remember those days. Yeah, thank you. Chloe, and then we'll round it out with our mental health expert.
Well, you know, I think that, you know, it's the advice that I tell my friends that have opened up to me about their fertility journeys now is what I tell them is that you just have no path or no choice you have no option but forward. So you have to keep going. You're going to get knocked down over and over, but you have to just keep going. You have to dust yourself off and try again. And you will eventually get to whatever that is. Somehow, some way, there are a ton of different options out there. And whether that is at the end that your resolve is to not have children, but you have to just keep going. And so that's just the biggest thing, because it's an exhausting process. And I had tunnel vision. And I think for years, all I thought about was, am I eating something that's going to help me get pregnant? Am I having sex at the right time? Is my husband eating the wrong things? Are we having too much caffeine? And then couple that with people getting pregnant around you and someone telling you, like Nichelle was saying, like over brunch, you know, like, and you are expecting that person to not get pregnant for like at least another year. You know, it's an incredibly crazy time. And I was so obsessed. I was like an obsessive person. I read message boards for hours that were like 10 years old. I mean, like crazy stuff. But you have no path but forward. That's what I would just say. You just have to keep going forward and be open to switching clinics. Switching clinics was an amazing thing for me to have fresh eyes and a different bedside manner. I think went very far for us.
Thank you, Chloe.
So I guess I would say that, you know, finding some way to talk about it and articulate it and get it outside of your head. You know, this doesn't mean you need to post it on social media, but I think that there are many ways to be able to find a way to talk about it, you know, writing it down in a journal, talking about it with the spouse and setting time aside to talk about it once a week, not having to do it all the time. But because sometimes people either really avoid it or they talk about it all the time, but, you know, blocking off that time. Finding a support group of people who are like-minded and going through similar experiences. Yeah, I mean, I think just really trying to get outside of your head, because I think so often we get stuck in our head and what we are thinking and we are feeling. And in order to really be able to, you know, figure out what to do with those friends that are announcing on social media about their pregnancies or such, I think you really have to be able to talk about it out loud. As I said, there's many different ways to do that, but finding that. And not everybody has to be the person that is going on social media either to announce it. Each individual person has to find what feels right and comfortable for them.
Awesome. Well, I can't thank you all enough. I know we all have so much going on in our personal and professional lives, and it really just means so much to Resolve that we can bring people like you together and have these honest conversations. We're going to help so many people, and I'm really grateful for that. We covered a lot of ground in a short amount of time, but I want to just say to our viewers and people that are listening, if you're new to the Resolve community, please visit our website, resolve.org. You can find us on Facebook, Twitter, YouTube, Instagram. You can find all of these beautiful souls I know are on Instagram. Dr. Covington, I don't know if you have a professional social media page, but please look her up to get some great advice. But I know I see all of you people on Instagram, and it just warms my heart that there is such a supportive community out there digitally, since we can't be together around a real kitchen table right now. And I hope one day we will. If you think this content is helpful, you can also support our mission with a donation through resolve.org, and we appreciate that. Again, we want to thank our sponsor, First Response, for their partnership in conversations. They've been a decade-long partner of Resolve, and we're very grateful for them. So I can't wait to see you all again soon, I hope. And take care, everybody.